Good day, doctors. I am Valleden Bancod from Jose Reyes Memorial Medical Center, and I would be presenting my meta-analysis entitled Absorbable versus Non-Absorbable Suture in Acute Tendo-Achilles Rupture Repair, a meta-analysis. Achilles tendon is one of the most common tendons being damaged during sports activity despite of it being the strongest tendon in the body. Achilles tendon rupture has an incidence rate of 18 patients per 100,000 population annually. In the United States, young males at 20 to 39 years of age are mostly affected. It commonly occurs in sports activities and affects males more than females, with as many as 84% occurring in men. The rupture can be treated conservatively or surgically. These are the most common complications which may occur after surgical treatment. My research question is that is absorbable suture favored versus non-absorbable suture in the surgical repair of Achilles tendon in terms of complication rate? There is no standard yet as to what type of suture should be used in tendo-Achilles repair because studies have varying results on the rates of complication and post-operative mechanical outcome of different suture types. Hence, this study was formulated. My objective is to compare the efficacy of absorbable suture versus non-absorbable suture in acute tendo-Achilles rupture repair in terms of function and post-operative complications, including infection and foreign body reaction. Here's the methodology. The literature search yielded a total of 123 studies, of which 13 studies were identified through PubMed, Medline, and Embase. After removal of duplicates, 99 articles were screened for relevance on the basis of the title and abstract. Of the 7 articles that were considered to be possibly eligible for inclusion, 4 were excluded for the reasons as shown in the figure. The remaining 3 studies were included in this meta-analysis. Inclusion criteria are closed rupture and those injuries occurring less than 2 weeks. Exclusion criteria are as follows: those that are open ruptures, injuries occurring greater than 2 weeks, patients who took steroids or quinolones, and patients with chronic Achilles tendon pain. For the results, the EFS Hindfoot score system evaluates the functional and clinical result of the extent of the wound healing, the sensation at the sural nerve area, and the angle of ankle dorsiflexion and plantar flexion. Analysis of the pooled AFS score data revealed no significant difference between the two. The weighted standard mean difference of combined effects showed no significant difference for absorbable over non-absorbable sutures in terms of pain evaluation VAS score. The weighted standard mean difference of combined effects showed no significant difference between the two in terms of deep infection. Studies assessing the occurrence of foreign body reaction in absorbable and non-absorbable suture treatments showed no significant risk. For the discussion, in those treated surgically, the widely used suturing material in the repair of Achilles tendon can be categorized into absorbable or non-absorbable sutures, having the PDS or the polydiaxonal suture as the representative suture for the absorbable type and the ethibond for the non-absorbable type. PDS is a synthetic monofilament wherein the mechanism for absorption is hydrolysis, as compared to the ethibond, which are a non-absorbable synthetic braided multifilament suture composed of polyethylene terephthalate. The advantage of monofilament sutures is that they are much less prone to potentiating infections than multifilament sutures because of the increased bioadherence of the bacteria and improvement in the ability of phagocytic cells to reach bacteria on or within the sutures. On the other hand, braided non-absorbable sutures have higher knot and suture security and holding resistance, and non-absorbable sutures are believed to be stronger. For their disadvantages, the use of absorbable suture leads to decreased tensile strength over time due to the nature of the suture itself. On the contrary, the use of non-absorbable suture is associated with long-term foreign body implantation, such as excessive fibrosis and stitch granuloma, that could interfere with the smooth gliding of tendon repairs. For the conclusion, both absorbable and non-absorbable sutures yielded similar results in terms of AFS score, VAS score, infection, and foreign body reaction. Absorbable sutures can be an acceptable alternative to non-absorbable sutures as they have similar functional results and we found no significant difference in their complications. Here are my references. Thank you for listening.